Good morning, good afternoon, and good evening. Thank you for joining the Wilson Center's Maternal Health Initiative, along with EMD Serrano, the healthcare business of Merck KGaA Darmstadt, Germany, for a panel discussion on the impact of COVID-19 on globally declining fertility rates and what slow or decreasing population growth means for the future, particularly what it means for women, the elderly, and caregivers. The birth rates are tied to many global issues, including healthcare, climate change, immigration, and economics, as just a few examples. So the need to address and discuss it is critical. I'm Sarah Barnes, and I direct the Maternal Health Initiative, or MHI, at the Woodrow Wilson International Center for Scholars in Washington, D.C. I'm joining you today from Bern, Switzerland. For those of you who are unfamiliar, the Wilson Center is a critical source of nonpartisan foreign policy research and analyses, where we work to tackle global issues through independent research, open and honest dialogue like what we're doing here today, and actionable ideas. At the Maternal Health Initiative, a thematic program of the center, we focus on a multitude of global issues around sexual, reproductive, maternal, and child health and health systems, and how they connect to gender equity, social and demographic trends, and of course, policy. Today's event is meant to look at root causes of slowed population growth in several countries, particularly looking at the US and Korea as examples, with a real focus on the impact of fertility rates on this slowed growth and the possible exacerbation by the current COVID-19 pandemic. We will also discuss what this could mean for the future and hopefully tap into that conversation on what can be done to either reverse this trend or adapt to this trend. Before we begin our discussion, I would first and foremost like to thank our esteemed moderator and group of panelists for taking the time to be with us today. We have panelists in several different countries and time zones, and your expertise and time is really, really appreciated. I would also like to thank EMD Serrano for making this event possible, as well as the team at MHI. And a big thank you to our Wilson Center co-sponsors today, the Korea Center and the Environmental Change and Security Program, as well as our incredible AV team. And finally, I'd like to thank all of you listening today. In a time with so many virtual events and webinars, we truly appreciate you taking the time to listen and to participate in this discussion today. We had just about 600 RSVPs for this event and got several questions for our panel already. So I know today will be a robust and lively discussion on this very timely topic. On that note, if you would like to submit a question for our panel, please send questions to mhi@wilsoncenter.org. Later in our program, my colleague, Shita Ramanarayanan, will pose these questions to our panelists. You can also follow the conversation on Twitter @Wilson_MHI with the hashtag MHDialogue. Again, that's mhi@wilsoncenter.org for your questions, and we'll do our absolute best to get through as many questions as we can today. And we've got a packed 90 minutes. So without further ado, I'd like to introduce Dr. Jennifer Dabbs-Shuba as our moderator. Jen is a global fellow here at the Wilson Center, as well as a political demographer and an associate professor of international studies at Rhodes College. It has been such a pleasure to collaborate with you, Jen, on this event, and I happily now turn things over to you. Thanks.
Thank you so much, Sarah, and welcome, everyone. We're so glad that you can join us, and I think the high number of RSVPs certainly speaks to the importance of this topic and the freshness of this topic. So what I'm like to do is introduce our panelists, and then we're going to have them talk for just a few minutes, and then I will open it up to our discussion here. So first we have Natasha Brahman. Natasha Brahman is EMD Serrano's Director of Global Government and Public Affairs for Fertility. In this capacity, she's responsible for relationships with governments, civil society stakeholders, and patient groups. And she works to broaden awareness and treatment access for those facing infertility. She's particularly interested in how demographic trends intersect with gender norms and societal notions of family building. Mark Mather, PhD, is Associate Vice President of U.S. Programs at PRB. He has more than 20 years of experience communicating population research to policymakers, educators, journalists, and to the public. Welcome, Mark. And Felicia Null, PhD, is an international health economist currently serving as director of the Institute for Advanced Study of the Americas at the University of Miami, where she's also a professor at the Bernard and Miller School of Medicine. Felicia founded the Mexican nonprofit organization Tomatelo a Pecho, a program that undertakes and promotes research, advocacy, and awareness of women's health issues in Latin America. So thank you all so much. I'm very excited to learn from all of you about this topic. And wanted to begin by inviting Natasha to offer a few remarks for us, please.
Thank you so much. Thank you for having me, and it's a pleasure to be here. Obviously, the topic of low birth rates, of declining fertility, and of COVID is an enormous one. We could be here for days talking about it. So I want to focus on one aspect that comes at the beginning of all of this, the decision to have a child or not to have a child. This decision is obviously intensely personal, but when made in aggregate by millions of times, by millions of couples, it can have huge implications, which is why we're here today talking about it. Now, one thing to remember is that most people, when asked in surveys, say they want to have children. In fact, they want to have more than one child. On this graph, you can see in gray what surveys show from a number of European countries, from Japan and the US, what people respond when asked about the ideal number of children to have. And in purple, so in gray, you see the ideal number of children in the EU and Japan. That's about 2. It's closer to 3 for US respondents. And in purple, you see how many children people have, the total fertility rate. People end up having fewer children than they say they consider ideal. Now, this data is from before COVID. So this gap between the ideal and the actual number of children was already there. And we can talk about why this gap exists, but it's something that is not unique to the COVID situation. Now, what factors influence the family building decision? Obviously, a big one is the desire for a child. And we have seen that usually this is there. Then another big one is academic, professional, personal ambitions. Basically, what does a person want to achieve? What does a person want to do before they have children? This could be completing a degree, getting started on a career. People have plans for their lives that they want to do before they have children. And so, having reached those goals or not having reached those goals factors into the decision of having a child. Another big one, relationship status. So the question of, am I in a stable relationship? Depending on culture or personal preferences, this question would be, am I married? Have I found someone to raise this child with? Because after all, most of us don't aspire to be single parents. So this part definitely has been impacted by COVID. Weddings have been postponed, dating was more difficult. A lot of those markers of relationship maturity have been put on hold. And I suspect that we'll see the ripple effects of that over the coming years. The data we're looking at now is for 2020. Those were decisions made at the very beginning of the pandemic, whether or not to have a child. So if your wedding was postponed in July of last year, that doesn't even factor into what we're seeing now in terms of birth rates. That will come later. And again, I suspect that we'll see the ripple effects of the COVID impact on relationship status maturity in the coming years. And finally, a big factor that influences decision-making for children is financial situation. So the question of, can I provide for this child in a manner, in a way that I consider adequate? In essence, the decision for a child usually requires a feeling of stability, a feeling of confidence in the future. And again, this is where COVID comes in. Especially in the first months of the pandemic, there was no feeling of stability. No one knew what was going to happen. It was a genuinely scary time for many people. Let's remember that. So I thought at the time the jokes about lockdown babies were a bit misplaced because people were scared, and people genuinely don't feel it's a good time to have kids if they're scared about the future. So this COVID baby bust that we're discussing today was unsurprising based on some past data. What I mean by that is that we can look at past situations, we can look at past crises to add additional context to analyze what's going on with COVID. This graph shows the birth rates in Italy, Spain, and Greece between 2000 and 2018. Before the financial crisis, you can see the rates were fairly stable or they were even going up. And then they dropped when the financial crisis hit, and they dropped even further during the Eurozone crisis. And remember, those three countries were particularly hard hit by the Eurozone crisis. And as you can see, those birth rates have never recovered. The GDPs of those countries have recovered, the birth rates have not. Spoiler alert, COVID made it even worse. Italy had the lowest birth rate in 2020 since they started keeping records in 1861. So again, COVID didn't exactly improve the situation. So in those three countries and with those two crises, a large part of the cause of the drop was the fact that the crises had an outsized impact on young people. There was huge youth unemployment, high job insecurity, people leaving university just couldn't find jobs. And, you know, to a large extent, there were also policy decisions that favored older workers over younger workers. Not saying those were wrong, but they certainly had ripple effects that no one had anticipated, down to the fact of changing the birth rates for entire countries. Will COVID look like this? Will this be the effect of COVID? We don't know. Young people are, again, most impacted by financial uncertainty. So this is certainly something that we're seeing again with COVID. But it will depend on how the recovery is shaped, how the recovery is distributed, what the impact of the distribution between generations will be. So there's lots to talk about. I'm happy to be here, and I'll stop there. Thank you.
Natasha, that was wonderful. Let's turn now to Mark to talk a little bit more about the US perspective. Mark.
Great, thanks, Jen. So I'm going to talk about fertility trends in the US, and I have just one slide I pulled up here really to provide some context. This chart shows the total fertility rate, or the average number of births per woman in the United States during the past 100 years. And as you can see, the fertility rate has fluctuated over time. It's tended to drop during periods of economic decline, such as the Great Depression in the 1930s. You can see another drop during the 1970s oil shocks, and then more recently during the Great Recession. So these declines have typically been temporary, but more recently we've had a fairly sustained decline in fertility rates. And as Natasha just described, the pandemic really seems to have exacerbated this trend. So Natasha mentioned a 1.7 total fertility rate for the United States. We now have provisional data for 2020 that shows that the TFR has dropped down to 1.6 in the US. So between 2007 and 2020, the TFR fell from 2.1 to 1.6. And just for reference, the replacement level fertility, or the number of births needed to replace parents in the population, is around 2.1. So moving from 2.1 to 1.6 births per woman may not sound like much, but for demographers, that's a pretty big change in a short period of time. And you can see that this decline actually started well before the pandemic hit, and it's really been linked to a combination of factors, including increases in women's educational attainment and labor force participation. Many more young adults are postponing marriage and childbearing to older ages. And then we've also seen a convergence in fertility rates across different racial ethnic groups, and also between foreign-born and US-born women. So just as an example, the fertility rate for Latinas was around 3 births per woman back in 1990. And the most recent data we have for 2019 or 2020 shows that that rate has fallen below 2 births per woman. So we've seen really steep declines for certain groups. I'm gonna stop screen sharing here if I can. And And just wanted to note that these trends are really moving the United States closer to the kinds of marriage and fertility patterns that we see in parts of Europe. And they're also contributing to slower US population growth. So we just now, this spring, we got our first results from the 2020 census. And those data show that the US is growing at its slowest pace since the 1930s. Fertility is one of the contributing factors to that slower growth, but we also have to consider rapid population aging, all of those baby boomers who are now reaching retirement age, and also lower levels of immigration. So when you have lots of immigrants, that means you have lots of young people arriving in the country. That creates what demographers call population momentum. Young families have lots of babies. So as we've seen a decline in immigration, we've seen a reduction in that component of population change. So the question is whether this slower population growth is good or bad. And it really does depend on who you ask. So all population change, whether it's rapid growth or slow growth or population decline, does come with challenges. And at the national level, falling fertility rates are not expected to have an immediate impact. Unlike in some countries, the US is not facing the prospect of rapid population decline. And in fact, the US is projected to keep growing for quite a long time, at least through probably during my lifetime. But in the long run, slower population growth could reduce economic growth. The US is also expected to face a caregiving shortage, as the number of Americans ages 65 and older is projected to nearly double by 2060. And at the same time, there are expected to be fewer children to care for them, partly because of the declines in fertility, but also because of changing patterns of marriage and cohabitation that could reduce the number of potential caregivers that are available to older adults. Many states and local areas in the US are actually already facing challenges relating to caregiving and facing other issues related to slower growth, and in many parts of the Midwest, actually experiencing population loss. On a positive note, I think most people would agree that the recent declines in the teen birth rate and the decline in unattended pregnancies are really positive developments. And population decline can certainly reduce pressures on the environment, especially if it's coupled with more sustainable consumption of resources. So I think the key is not to become too fixated on the overall fertility rate or the number of births, but it's more important that the United States develops policies and strategies that will help ensure that the country is successfully adapting to an aging population. And it is nice to be in our position where there are other countries that are kind of ahead of the United States on this aging curve, because it means that we can see the kinds of policies that other countries are putting in place, what's working, what's not working, and potentially apply those here. Thank you.
Thank you so much, Mark. And you brought up caregiving, which is a perfect segue for us to have Felicia share a few remarks with us, please. Felicia.
Thanks so much, Jen. It's such a pleasure to be here and to be collaborating with the Wilson Center and of course with Mark KJ Darmstadt and Mark Serono. So I probably will take just a little bit more of a global view, and yes, pick up first on some of the things we haven't worried about yet and might want to talk about also more later in our event. On the caregiving side, and Mark correctly said that there's going to be increasing pressure. Our existing estimates from a Lancet commission that we worked on in 2015 showed that women's contributions to health and to healthcare are valued at 5% of GDP at least, and about half of that is unpaid, undervalued caregiving. When we are now in our updated work looking at a discrimination, that goes up to 7 to 8% of GDP globally. And it's a set of contributions that are undervalued, undersupported, and not considered as part of our healthcare sector or economic sector, and have a huge impact, of course, on gender equity and gender equality. Another, I think, major force to consider in our event today is what I call the sandwiching of women in a certain age between having to care for the young and having to care for those who are older. But I want to put that in the context of epidemiologic transition, which is something we're seeing pretty much, around the world, but in a slightly different way in the region I'll talk about in a minute, which is Latin America. Basically, we're seeing, a transformation of the causes of death and disability to chronic and non-communicable diseases, including mental health issues. These are more costly, these are more complex, these are more long-term, and they require much more caregiving. And that's the kind of transition we're going to see, and it's going to fall mostly on women. I'd also like to take a moment just to think in this context a little bit more on the equity and the justice issues. So when we're thinking about reduced fertility rates overall, we need to though think about those population groups that are still going to be facing high fertility rates alongside aging, less access to education, the digital divide that's increasingly problematic for these individuals associated also with COVID. And these are mostly going to fall on poor women and single mothers. And they're going to have more unwell family members to take care of. So in this global context of reduction of fertility, I think we need to think carefully about those who are most at risk. Related to that, of course, and it's increasing with COVID, all of our data suggests this, all of the data roundup suggests this, violence against women, gender-based violence, and also violence against children. Before COVID, we were speaking of 1 in 3 women in their lifetime, at least 1 in 5 children in their lifetime. And simply said, many countries around the world provide no options or no safe options to women who have suffered rape at any age, however young they are. So thinking right now about the reproductive and health rights of women, young and old, I think is extremely important in this overall context. Let me turn briefly then to Latin America, because we may think about this as similar in some ways globally, but there are things that make it very different. Poverty, violence, extreme inequity, and sort of the upheaval that we're seeing repeatedly through different processes. They're going through a tremendous process of aging and of epidemiologic transition. And that process is happening in a period of a couple of decades, whereas in high income countries, there were 200 or so years, 2 centuries to adjust. On the aging side, we're looking at projections saying that 1 in 5 people who live in the region will be over the age of 65 by 2050. When we talk about epi-transition, we are thinking about basically an inversion in the causes of death and disability. So whereas around 1960, 1970, the majority of deaths were associated with so-called communicable or malnutrition associated issues, today 80% are chronic or non-communicable disease-related deaths. Again, that require that complexity of caregiving. For the Latin American region, we need to think carefully as well, and probably globally, about adolescence. So whereas we're seeing declines globally, that isn't really the case in Latin America. Some small declines, but overall, these rates have been very sticky and very, very high. We're about the second highest in the world in terms of adolescent pregnancies. And again, we're looking at a number of countries that prohibit providing contraceptive methods to teenagers, and certainly safe solutions when there are unwanted pregnancies and even rape-associated pregnancies. Migration and displaced populations, so really the opposite way of thinking about that compared to the United States. We see a push out of the region into particularly the United States of those who are, yes, of reproductive age, but leaving behind typically the elderly, the sick, and the young to care for. So migration is a big factor to think about in the Latin American region. Again, to say that for situations of poverty, we're basically looking at all of the caregiving and other burdens being focused on young women as well as older women. When we think about the young women side of it, however, we have to think about the education and all the other implications. I know we'll get into policy and think about that a little bit later, but I finally wanted to say that we're looking at countries with very fragmented social security and health systems. So any access to publicly funded or financed caregiving is associated with very fragmented systems that cover only a small segment of the population. We can look at some of the more innovative solutions around income generation opportunities for women and for families as a whole related to caregiving in the region, and places that we can go with that, I think, later on when we talk more about policy. And also finally to say, in the COVID context and thinking about something truly more positive, I do believe that this change, this dramatic change in technology of communication will play itself out in terms of telehealth, in terms of teleconsultation, and maybe even some kind of telecaregiving that can, in many senses, relieve the burden on women if it's associated with gender proactive policymaking overall. I'll end with that. Thank you.
Thank you, Felicia. And we are fortunate now to have our fourth panelist joining us who's had some technical difficulties, but we appreciate it very much. Dr. Kwang Hee-jun, who is demographer currently teaching at Cheongdam National University. His current interests include local population decline, very low fertility, as well as the impact of COVID-19 on the already low fertility rate in South Korea. So thank you so much. And as with our other panelists, we just invite you to offer about 4 to 5 minutes of remarks, and then I have lots of questions for everyone. Thank you.
Thank you, Felicia, for your invitation to this panel discussion at the Wilson Center at this stage. And I'm very interested in the comparative analysis of fertility drop during the pandemic in East Asia. And China and Korea and Singapore all have experienced rapid transitions in fertility from high to the low levels. In fact, many Asian countries are around and below the replacement level of fertility, 2.1 births per woman. The current fertility level lying around at the very low and crippling in some Asian countries. So like Korea, Singapore, and Japan. So if the data I have are accurate and reliable, and I have some doubts about the UN figure in 2019 about China, but the United States is still the exception to the general trend, though the high infection and mortality rates during the pandemic reveals the severe ordeal during the pandemic in the United States. According to the fertility statistics published by the National Statistics Office, the most severe damaging effect of the COVID-19 on fertility comes to China, then to Korea. According to the statistics, the damaging effect is fairly moderate for the United States, Japan, and Singapore, all the market-oriented and liberal and highly advanced economy. In Korea, total fertility rate was estimated about 0.92 in 2019 before the onset of the pandemic, and 0.84 in 2020 during the pandemic, and projected to the 0.72 in 2021 in the next year, this year after the onset of the pandemic. Currently, experts estimate COVID-19 contributed to the drop of fertility in about 10% in 2020. And many of them expect that this drop will continue in addition to the 5 years to come. This will be a damaging effect on the already aging population structure. According to the decomposition, the share of the contribution was about 5.8 due to the marriage postponement. Now in Korea, all the small businesses related to the wedding are closed. So a sort of social disruptions and economically damaging effect. Also, some non-births of the second birth is very small, but the stopping of the marriage migrations during the pandemic also contributed very much to the decrease in fertility. In fact, airport lockdown. According to the 2017 population projection by the Statist Korea, the proportion of the population 65 years over is currently about 16% now, but will be about 46%. Korea will be the oldest country. We will have to face the care of the older persons, particularly weak, physically weak and mentally weak. In fact, suffering from the stroke, cancer, and senile dementia. All we have to concern with the care economy in the next coming 50 years. In fact, the serious problems comes out, particularly our Korean National Statistics Office projection realized, and then in Korea, it was the sum of the young and the working age population will be smaller than the older persons in a half a century. So South Korea is becoming unsustainable, both demographically and financially, at each and every time in the near future. Recently, China declared they will allow young couples to have more babies, up to the 3. I will mention the eventual fate of China's rich children policy. Removing the penalty for the more baby than 3 children would not be enough. They have to do more. That's what I can tell at this time related to the low fertility and rapid aging and the long-term care issues related to the rapid transitions during the pre-pandemic and pandemic period. Okay, thank you.
Thank you so much, Kwang-hee. And I want to remind those of you joining us that after this facilitated discussion, which we're about to begin, we will be opening up to audience Q&A. So if you do have questions, you can submit them via email to mhi@wilsoncenter.org. And then also we are on Twitter at Wilson_MHI and using the hashtag MHDialogue. Okay, so many interesting things that everyone brought up, and the way that I see this topic is really in thirds, and so that's how I'd like for us to discuss this: drivers, implications, and policy. So I will move us along that way, and first, then, to begin with drivers. And Natasha, when you spoke, you gave us a really wonderful and comprehensive list of what it looks like, the ingredients, I guess we could say, in the decision to have a child. It is, and as you rightly mentioned, it is so interesting when we think about something that is seemingly a very personal and individual decision and incredibly complex, but when we aggregate it, we really do see overall patterns. And so it's those patterns that I want to talk about. There was a podcast that I know a lot of people listened to recently because a lot of people sent it to me, and it was on The Daily. And so once the news came out about the United States having a COVID baby bust, The Daily, through the New York Times, did a podcast episode about the US, and then they did a second one about Japan. And there was one line in the podcast about Japan that really struck me, and I thought it was quite provocative. And it said, maybe what we're seeing is that women are finally empowered to live the lives they always wanted to live. And that being that they would choose a fulfilling work life over a life where they stayed home raising children. Very provocative statement, and one that I thought we could actually open up. And I thought we could first talk about women in the workforce. And so I know there are some general patterns, as Mark mentioned, that what we're seeing with COVID is a continuation of low fertility rates in all of these advanced industrial countries. But then COVID-19, of course, changes or accelerates those. So I would invite all of you who have something to say about women in the workforce, perhaps starting with Natasha. How has participation in the workforce or attitude towards work played a role in what we are seeing in terms of low fertility now or accelerated under COVID?
Sure, and there's so much to unpack here. So let's start with the general trends before COVID. For the past few decades, women have spent more time in education. They've spent more time climbing the ladder at work, so to speak. So, achieving educational and job goals. And that has contributed to factors like later marriage, delayed childbearing, all of which has contributed to driving down birth rates in countries across the globe. So, I don't think anyone would stand up and say it's a bad thing that women are getting more education or that they're working. It's simply been a side effect that has led to additional sort of decrease in birth rates. Now, let's keep in mind that in many countries, the dual income couple has become the norm and has actually become a requirement to live in urban areas. That in many cities, not just in the US, but around the world, rents are sky high, the cost of living is very high. So even just to finance, you living in a city, you probably need two incomes. And then, the question comes, how many children can you add to that calculation? Do you need more space? If so, can you afford for one person to leave their job? Probably not. So, this is a calculation that couples clear across the world have to make of living standards versus childbearing choices. And so I wouldn't even say that it's women living their best lives that leads to low birth rates, although that certainly contributes to women having more freedom of choice. But I would say that there are other factors that I've mentioned, financial struggles, personal attainment goals or educational goals that people want to reach, that all contribute to delayed marriage or delayed childbearing decisions that overall, again, when taken in aggregate, lead to lower fertility rates.
Very interesting. And Kwanki, this reminds me of, I had done field work in Singapore at this point over 10 years ago, but many young people there told me that they couldn't afford to move out of their parents' homes. And therefore, of course, they had low fertility rate because who wants to get romantic when you are still living in your parents' home? So I was wondering if you could add on to what Natasha said about the role that women in the workforce perhaps plays in some of the low fertility we're seeing in South Korea, Singapore, other places in Asia.
Young people in Korea want to get a good job, but the good job is not available in the rural areas. They have to go to the metropolitan areas, particularly the Seoul and the neighboring provinces. So they have to live alone. They have enough money for the marriage. Industrialization and the urbanization all hampered them for marrying, meeting good persons and marrying them at the right time. So in Korea, we have a ever increasing single person households. That's a great hindrance on the increase in fertility, and also all these things works the negative impact of the living arrangement in the fertility rate and care economy in this country. Young people are powerless. So they have to get some power to handle their own destiny in the early in the life course.
So you said that marriage is expensive and we see more single person households. Can you explain that one to me a little bit? Just because I would think there are many savings to marriage, just the same as there would be to having a roommate or something like that. So is it the wedding itself, or is there an actual marriage cost that's involved here, or are these single people still living at home?
In fact, the housing is very, very expensive, particularly in Seoul and other metropolitan areas. They cannot afford that housings. particularly during the incumbent presidential leadership, the housing prices soared to the almost 100%, I must tell. So that's a great failure in the management of real estate prices. So that's also dampening effect of the social disruptions and economic uncertainties on the already very low fertility rate.
Okay, great, thank you. Felicia, the economic situation, economic trends in Latin America are different than we've in Europe and in Asia. So how similar or different is the role of work and education in women's fertility choices there?
Thanks, Jen. And you said provocative, so let's be a little provocative, I think. First, we have to say women don't have choice if they don't have choice. Right? So you deny access to reproductive health rights, and they do not have the choice that they should be able to have. And I think we need to recall that we are often speaking about only the group of women that does have access most of the time to choice, and not those who do not. And that's typically way too often associated with poverty. And we know that during COVID, independent of the increase in gender-based violence that we know also happened, intensified because there was so little access to primary health care and other options of moving from the home. So the first thing I'd say is no choice if you don't have choice. The second is, and I can't remember what podcast I was looking at recently or a paper that I was looking at. I don't know if you all remember that sort of old commercial about bringing home the bacon. Remember that? It's maybe before some of your time, right? That it was this show of this beautifully dressed woman who started by preparing breakfast with bacon, then put on a wonderful business suit and went to work. And then by the evening was ready to give it all to her man by the evening and go out dancing or to cocktails or to a business dinner. But where I'm getting at with this is that I think for a long time, we have told, and I certainly used to tell my students to stop doing it, you can do it all, right? And it's fine if you do it all because we're super women. So what I'm trying to get at is until we have gender proactive, and I mean gender proactive policymaking, particularly we can talk, but not only about men and women, where the joy and privilege of being able to take care of one's family and do caregiving is a joy and privilege that's shared through policymaking and economic incentives with men and women. We are going to continue to be in a situation we talk about bringing home the bacon and working to be able to do all the things we want to do to have a reasonable life. And again, these are about choices and differences, but they're also about policies and incentives that make gender equality structural and difficult to change.
Okay, thank you. And that really makes me think about something that Mark started to mention in his comments about taking what we're right now talking about in terms of national level data, but breaking it down more, because Felicia, you mentioned choice, and we know that for certain groups in societies, there's more or less freedom of choice depending on their place in society, socioeconomic status, and so on. So Mark, how does this relate to various subgroups in the United States? Are there certain ones that you would point us to as having maybe falling outside this pattern that we talk about? Maybe they have relatively less education, their fertility situation is different. And this could be ethnic or regional or so on.
Yeah, so I would just kind of echo what Natasha was saying, that we can view this fertility decline as a good thing if it's because more women are going to college, entering the workforce, having more control over the number of children that they're having. But the other side of that coin is, there's lots of people who don't feel like they have the resources to start a family. If you look at the extremely high housing costs right now, in combination with labor market challenges in the wake of the pandemic, that's not really a great scenario for young adults, and especially women during the most recent economic decline. And we know that some of the effects of the recession could be long lasting. So we know that we have growing inequality in the United States. Increasingly, it's education that that's dividing us in terms of marriage patterns, patterns of cohabitation, and I think increasingly we're going to potentially see that with fertility patterns. So right now, we have seen over the past 10, 20 years, a convergence in fertility rates for people in different racial ethnic groups. If you look at education, however, fertility rates for those at higher levels of education has dropped to very low levels, like 1.5, 1.6 births per woman. But if you look at those with a high school diploma or less, fertility has remained high at about 3 births per woman. The difference is that many more of those births are occurring to cohabiting couples rather within marriage. So there's some interesting patterns. We don't know yet exactly how the pandemic is going to affect those patterns, but we do have some pretty substantial divides in this country, and those are reflected in the family formation patterns that we see.
Okay, very interesting. And as you mentioned, for those who are listening in, joining us, we're really just at the beginning of understanding what all of this means, because it does take a while for the baby to cook and be ready. So we don't exactly know what these patterns will mean for us, and are just seeing it. But that brings me to wanting to discuss the implications some, because from the data you all have shared with us, we see an acceleration in some cases of population aging. So that seems to be the number one implication in terms of demographics. And we can think of this in terms of a shifting center of gravity from younger ages to older ages, and the higher proportions of those at older ages. Of course, economic implications are mentioned by many of you. And we know that we have data on fewer workers to support increasing number of retirees and so on. But let's put this in a comparative perspective, because the types of social safety nets that are available in this group of countries we've talked about here are wildly different. And yet we still see similar patterns of lower fertility, which is always interesting. Are there certain countries where you all think that we will see a greater economic impact of accelerated population aging, excuse me, and countries where it might be less so? And I'll actually challenge Mark on this as well, because you mentioned the United States, a couple people mentioned the United States is somewhat behind its peers in terms of population aging, yet we have institutions that might make us vulnerable to that. So perhaps we can go in reverse order. And Mark, if you would speak to how well prepared you think the U.S. institutions are to handle population aging.
Yeah, well, Natasha, Felicia, you had mentioned some of the issues, especially that women face in trying to balance caregiving and work responsibilities. And those are really often very severe challenges in the United States. We don't have some of the supports that certain countries in Europe have in terms of, long-term care insurance, paid care, the availability of affordable and quality paid care, not just for older adults, but also for children. So I believe the United States is the only country where we don't have guaranteed paid leave after the birth of a child. And so that lack of government support, I think, becomes a real challenge. And with the aging of baby boomers, it's really who can afford to provide paid care for their family members. The bulk of caregiving is provided by family, and it's typically women, daughters, who are providing that care. So they're really providing a huge subsidy in terms of the cost that is being borne by these women. Many have to exit the workforce. There can be lifelong effects on women's earnings. So it's a gap that really needs to be filled. I don't think that we've really addressed it, or that we're prepared for what's coming with baby boomers starting to reach retirement age.
Thank you. Felicia, could you talk some about this as well? Because I know that you've done so much about care, and you mentioned the care economy.
So, yeah, of course, I think we need to really think out of the box for many countries. Now, you also have some countries sort of more into the process than others. And yes, it's true in Latin America as well. Uruguay, for example, is far further into that aging process than many other countries in the region. And to some extent, it's poverty associated. But I think we need to focus on the policy innovation level. And again, think about what we can harness with COVID. So there's been a lot of thinking in the region about income generation, particularly for women, programs related to childcare. Colombia had one of the earliest with the Casas Comunitarias Hogares, Madres Hogares. It started in switching back and forth to Spanish, in 1986, more or less, has been in operation. So we've seen different ways in which there have been these sort of innovative programs, but I don't think they've thought a lot about elder care. It's mostly been around care of children. I think that's one huge opportunity. Another is, at least before COVID, there was quite a bit of unusual migration into particularly Mexico, but not only, Panama, Costa Rica, and others, from the US, from Canada, by those who were in a process of aging and felt that they could sort of live better and get some care. So for the country that can be a recipient, this could actually be an important source of income, but they need to think very carefully about how to make that more equitable and how to provide that kind of quality care for people who may spend 6 months or several years in country and then repatriate at the point when they need more care back to their home. So I think that kind of elder care migration can actually be very interesting. Now, thinking about COVID for a minute, I mentioned it just a little bit, is that I really have very high hopes for the fact that we've been able to leapfrog in the provision of healthcare into telemedicine. Like, if it hadn't been for COVID, there was basically no way to finance it. It was completely unacceptable, and there were huge barriers. So everybody had to travel to get care. But now we can think of insurance companies paying for teleconsults again, but also sort of telemonitoring of the aging, which will allow them more time to be able to spend in their homes, more time to be able to spend alone, and more variation and opportunities around the provision of care. And that's something that I think we can think about in many parts of the world, although it's going to be less typical in the way that families function and societies and culture and the economy functions in Latin America. And then I don't know if I'll have a chance to touch on it again. You tell me if I will, but I think there's a huge role for the private sector. And there are some companies that have been thinking about this for a long time. And one of them, I have to say, is, and not only because they're on this, but the truth is they've been thinking for a long time, from Merck KGaA Darmstadt, about healthy women, healthy economies, about supporting initiatives like embracing carers, but basically also walking the talk, where the company itself is looking for ways to be able to support what is this increasing demand for caregiving. And so I think there's a huge role for the private for-profit sector as an employer, but also as an innovator, and hopefully more and more for women leaders to be able to say something from the corporate world.
Thank you. Natasha, did you want to jump in and talk a bit about aging from your perspective?
Sure, thank you. So I think one of the things that we forget in this discussion is that looking at the differences between countries in different regions, in this case, Europe and East Asia. If you look at Germany, for example, Germany has had a fertility rate of about 1.4, 1.5 since the 1970s. So we've been at that very low level, for decades. We've staved off the effects through immigration. Now, this has happened to a much lesser degree in Japan, in Korea, and other East Asian countries because it's simply less politically palatable. So I think there's a real difference here in looking at the impending effects of aging that will hit those countries very differently. One thing I do want to mention, especially when it comes to policy making, is that many of the countries that we're talking about are fortunately democracies. And the people who vote for whatever policies get enacted are increasingly old. So the question of how funds get distributed, what kind of decisions get made, what kind of priorities are set, are increasingly skewed towards supporting an older population, which is perfectly understandable, it's perfectly fine, but it means there are trade-offs, especially in reduced budget situations, that can lead to a spiral where you have, less funds available for young people, for young families, and it becomes a self-perpetuating pattern. So, it's that's in one part, that's how democracy works. But let's keep in mind that the people who vote are increasingly old in lots of countries around the world.
Okay. And, we'll be going to the audience questions in just a moment, but before we do so, there's one more thing I wanted to make sure that we get to, and Kwang Hee, I'll turn this to you first. So when we discuss population change, just for those who might be new to the idea of demographic change, we really think about 3 different drivers: fertility, which we have focused on here, mortality, and migration. And so one of the things that is floated often is using immigration to compensate for population aging. And among the set of countries we've talked about here, there are wildly different attitudes towards using immigration. In Asia, particularly in South Korea, what are discussions like about using immigration, particularly bringing in care workers for the older population, or if there are other segments where this is discussed? What are those conversations like, and how perhaps have they changed over time as the general population begins to understand the severity of population aging?
I think we need more babies and more immigrations to cope with the population issues, particularly the depopulation and rapid aging, particularly the long-term care issues. We need more immigrants. So young workers are shrinking in size, and we have to get the more immigrants from the Southeast Asia and China. But we are divided in the issue: pro-immigration groups and anti-immigration groups. Ideological conflict is very strong in this country. Some people argued for the pro-natalist policy, and some people argue for the pro-immigration solutions to the all the problems raised by the rapid population aging and the shrinking rate of economic growth. So Germany is lucky in a fact that the fertility rate is very low, 1.4. When we had a fertility rate 1.4 in the early 200s, we all suggested immigration should be a solution for the damaging effect of low fertility on the aging and sluggish economic growth. But the government didn't accept that idea. They believed that we can raise the fertility rate to the replacement level, but that now the fertility rate was lowered to the level lower than the 1.0, not going up to the 2.0. So all the policymakers have no clear ideas about what's going on demographically and what will be the impact of that kind of the low fertility on the future population aging and potential rate of economic growth. So
now that's
to make some decisions,
there, right?
Yeah.
Okay. Gap in understanding. Well, and Natasha, in Europe, certainly this is a region that has gone from being a sender of people for a very long time to one that is becoming more of a recipient. But we've seen some political implications of that. You could perhaps even look at Brexit as a political implication of that. So how have discussions about immigration and the role as a policy solution for population aging changed in Europe recently? And does COVID have an impact on that as well?
Well, COVID, I mean, sort of the most immediate impact has obviously been that borders were closed. There were fewer people coming in. There was within the European Union, there was much less movement of people. So just from a sort of immediate effect, that certainly reduced immigration to a trickle, because the borders just weren't as open as they were before. Now, as you rightly point out, this is a hot button issue in terms of how much immigration is a good thing, what kind of immigration, from where. And you know, we would need at least 2 more sessions to just wade into that. So I will just say that the fundamental difference is still that we're talking about, you know, what kind of immigration. Yes, there are some fringe groups that don't want any immigration at all, but compared to sort of the very restrictive immigration levels in many East Asian countries, especially in Japan, you know, it's more about what kind of immigration and how much, and not whether or not to have it at all, if that makes sense.
It does, yes. And Felicia or Mark, would either of you like to comment on this? Because if not, I have another provocative question for
I will
us.
just comment briefly that to mention that were it not for the relatively high immigration levels in the United States, we would be facing population decline pretty soon. So immigration is the reason that the United States has a relatively young population. It's the reason we're continuing to grow at a pretty rapid clip compared to many countries in Europe. So I realize that most countries do not regard mass immigration as an acceptable solution to population decline. Many have imposed strict controls against immigration, but you can't deny that it works in bringing in young people and keeping the population growing.
So I guess I can't not say, thinking of Latin America, that the responsibility of government as a recipient, at least I believe, is to care for your migrants and to treat decently those who come documented, and particularly those who come undocumented because of suffering, poverty, violence, or climate change. And we haven't even mentioned this in this, and I appreciate it. This has to be another discussion, but the whole question of how climate change and disasters are going to move people around. And again, to go back to this point that, many of those who migrate under forced conditions. And that's the space where I think we need to make sure that women's bodies, women's reproductive rights are really cared for.
Thank you. Okay, I'll ask one more before we go to the audience Q&A, and this will get us back to the drivers one more time, because whenever I talk about this issue to people, they do mention government incentives to have children. And so wanted to make sure that I gave the panelists an opportunity to talk about incentivizing women in particular to have children, and whether or not we've seen that work. And we already said how complicated it is to have a decision to make, to have a decision to have children. Is there a role for the government in offering cash payments or child care centers, or even Natasha, perhaps offering subsidies or health insurance for assisted reproduction? Or does none of it work?
Would you like me to start?
Actually, Felicia, did you want to talk about that for just a moment?
Just to briefly jump in and say that, but I think we also need to think about the elderly, the elder care centers as well, and the support for those who are living with chronic diseases or other illnesses. Because when we think about a policy situation, so gender proactive paid leave, which includes other parts of the population, not only babies and young children, as I think really important, because part of the decision to be able to have a child is also about whether or not you have other caregiving responsibilities that put you in that difficult situation. So I think it's sort of a life cycle approach to caregiving, and thinking about it as part of the economy.
Yeah, and that's so wise, of course, because as we've already seen, the average age at which people have children is creeping up in many of these places, and that means that they're more likely to face that sandwiching. So it's an excellent point. Natasha.
Sure. And I think we should draw the distinction between encouraging people to have children. So, whether that's giving them money or running ads, promoting childbearing, and removing barriers to the choices that people might want to make in regards to having children. So those are slightly different nuances on this issue. And, I mentioned earlier that people say they want to have more children than they end up having. And a lot of that is due to these kinds of barriers. A large part of it is also aging. People start later, so they end up having fewer children overall. So age is a huge part. But there are these barriers of combining work and family life, combining work and caring responsibilities. And if you look at those countries where the gap between the ideal number of children and the actual number of children is fairly low, so countries like France, you see countries that have a very robust and well-funded government system of providing daycare, of providing elderly care. It's not perfect by any stretch, but there are provisions in place for parental leave. There are provisions of people being able to make choices without being afraid that they will lose their job, that they will lose their home. And so it's perhaps less about, running pro-natalist policies specifically, and more about removing barriers for people's choices that they might want to make for their life planning. In terms of, you mentioned funding for assisted reproduction, that is certainly a path that countries, especially in Europe, have taken, where ART, so assisted reproductive technologies, are in many cases funded by the healthcare system. There is obviously, for those people experiencing infertility, and let's remember that's about 1 in 6 couples, that is a huge deal. The fact that you don't have to suffer infertility without assistance is a big deal for those patients affected. Does it impact fertility rates? Well, I would say it depends on the country and how well funded and how well accepted these methods are. I'll give you the example of Denmark, which funds IVF fairly generously, and where about 8% of each year's cohort is born through medically assisted reproduction. So would none of those 8% have been born otherwise? Well, that's something we can certainly discuss, but 8% is born through medically assisted reproduction. And that's a pretty big part of each year's birth cohort. So I'll stop there.
Well, thank you. And Kwangi, we are going to go to the audience Q&A in a second, but I have to ask about China, because this is on a lot of people's minds. Of course, the move that you mentioned as well, from the one-child policy to just a few years ago, a two-child policy, and the recent announcement to going to a three-child policy. So in China, what role does policy incentives or policy decisions like this, what role will that be expected to have in China's future birth rate?
I think the China's birth rate will sink to the Korean or Singaporean or Japanese levels. In fact, in 2019, the fertility rate was 1.7, very similar to the United States level, according to the UN figures. But it dropped to the 1.3 during the pandemic. But we have to make some adjustments in those figures. But in 1978, the China adopted the one-child population policy during the Deng Xiaoping's leadership. And then they relaxed the one-child policy and increasing the birth target to the two-child in 2013. Now, 7 years later, they have to change their birth target policies to the 3 children. In fact, when we look back upon the past, the two-child policy has really effect on increasing the fertility rate. Third child policy, the young couples, particularly living in rural areas, still having strong preference for the sons, can have more freedom to choose the number of the children, but in urban areas, in Beijing and Shanghai and Guangdong or Shenzhen, all areas, just the young couples end up having one baby or deciding to remain childless on voluntary basis. Very same patterns observed in East Asian countries suffering from the very, very low fertility rate. That will I believe that all these things will the China's eventual fate of the population decline and rapid population growth. And I don't think the Chinese communist leadership and authoritarian leadership will not solve that any perfect solutions. They have to adopt more market-oriented, liberal, clandestine leaderships in providing some incentives and disincentives in having the babies and establishing the long-term care facilities. China is a huge country, still about 5 times larger than the United States in terms of the sheer population size. So they have to think about in different ways. That's what I am thinking at this time. Yeah. And they will follow the same pattern observed in Japan, Korea, Singapore, Taiwan, and Hong Kong.
So it seems like one of the big lessons, I know, see, I have some unstable internet, so I'll try to get to that, but it seems like one of the big lessons we see here is that these gender equity policies will make some of the biggest impact, and thinking in terms of the entire life course versus just trying to do some of the cash payments type things that we've seen in Russia and elsewhere in terms of incentivizing women to have children. Let's turn it over to...
So I would like to add some other things. Establish some more comprehensive youth policies. That the micro incentives would not be enough. Particularly there's birth bonuses and family allowances would not be enough. The government should provide some policy related to housing and jobs.
Mm-hmm. Yeah.
On a comprehensive basis. The emphasis should be given to the youth in the same way given to the old age populations. So that could give some double burdens on the government budget.
Yes, but perhaps be a much wiser financial decision than just focusing on one to the
Yes, the government should provide very wise and clever decisions in coping with this kind of population changes.
Okay, great, thank you. Dikshita, what do we see in terms of audience questions?
Yeah, we've got several questions from our audience, so we have grouped a few related questions together to speed through as many as we can. So I'll ask 2 questions at a time, and everyone should feel free to jump in and answer any of the questions you'd like. So for our first 2 questions, first, what do the panelists think about the relationship between the 2 big issues that COVID-19 has been said to impact? So population and the environment. Can you speak a little bit more to this relationship? And the second question, does the higher population growth rates in some parts of the world have any impact on countries with declining birth rates?
Thank you. The elephant in the room, of course, to talk about the environment and perhaps the upsides of what some environmentalists call a population correction. And I teach environmental politics and have for many years, so I know that even the young people today will bring this up quite frequently. So let's go ahead and address it. Do we see an upside to shrinking or declining population numbers in terms of planetary impact?
I can jump in just to mention, as I mentioned earlier, that it's not just enough to pay attention to what's happening with population. You really do need to look at what's happening with consumption, and the United States in that regard is, I think we make up less than 5% of the world's population, and some of the estimates I've seen show that we use up 20% or more of the resources, and energy. So that's an important issue. And then the other thing I would mention is that the United States is also a big country, and so the types of environmental issues that we're facing are often very local. And so the types of issues that are faced in the coastal areas are different than those in the desert areas where we've just seen reports of water shortages. And so the fact that the population in the US is growing at very different rates in different parts of the country, and there are different population pressures, that has different implications depending on where you live in terms of the environmental impacts.
I can go next.
Oh, go ahead, Natasha.
Sure. So I would also say that let's look at where populations are still growing and where they're stagnating or shrinking. And if you look globally, you have a situation where over the next decades, the biggest growth will come from sub-Saharan Africa because their populations are young. You have a number of countries that still have a fairly high fertility rate. And so over the rest of the century, these countries will continue to grow. And there's some estimates that actually Nigeria will become the most populous country on the planet by the end of the century. At the same time, you have in Asia a huge disparity between East Asia with falling populations in many countries, in South Asia with still growing populations, and they will continue to grow in the next couple of decades and then level off as populations age. Latin America, Europe shrinking, US kind of stable. So we'll see the global population actually start to fall by the end of the century. So I would say, looking over the last 70 years, we've seen a lot more growth in the global population than we will see over the next 70 years. So that doesn't make our footprint on this earth okay. I'm just saying that the population is already leveling off across the world. We now have a global fertility rate of 2.5, I believe, just under 2.5. So we are not at the same exponential population growth that we were at a couple of decades ago. And that's important to remember in terms of the bigger environmental picture. Now, of course, with rising prosperity comes more consumption, a bigger footprint, environmental degradation, loss of ecosystems, loss of biodiversity. Those are all things to consider. And frankly, I think some of the solutions, if you will be in migration over the next decades, as those countries who struggle with maintaining their populations source younger labor, source people from those countries that still have high birth rates or have younger populations. Frankly, I think within my lifetime, we'll probably see a scramble for population, not just a war for talent, but just a war for people, to have people come and migrate to those countries that would otherwise be significantly shrinking.
Felicia, do you want to comment? And then we're going to get 2 more questions.
So just to jump in very quickly and pose a question, which is one of the, I think, good things we saw was that reduced mobility helped the environment. Right? And so one of the questions I ask myself is, what is going back to work going to look like? And if we have new opportunities for going back to work, which don't involve so much transportation, that may actually be a really important out. But not only thinking about environment, I also ask myself, what that will mean for families, caregiving, and combining work with other aspects of life. So I just think it's really worth thinking about what the new workplace is going to be and going to look like in those spheres: population, environment, and gender equity.
Very fascinating, yes. Okay, Dikshita, any more questions?
Yes, I've got 2 more questions. First, how has decreased teen pregnancy numbers contributed to these lower birth rates? And how can access to contraception be a big piece of this puzzle? And then the second question is, what are the implications of these fertility trends, especially the divide between the global north and the global south? What are the implications of these trends on reproductive and maternal health policies?
Okay, excellent questions, and certainly with a theme there, thinking about contraception and reproductive and maternal health. Who would like to tackle that first?
So that probably falls in my court, and I've said a few things about that already. One of my greatest concerns is, what I call the last mile, or the increasing inequities. I'm worried about particular population groups really being left behind when we think more broadly, and that's just impressive problems with inequity. So if we see increasingly around the world, I think Natasha was beginning to speak to that certain countries and certain groups within those countries, for possibly the wrong reasons, are those that are having higher fertility rates. Then what we're going to see is a bigger gap between the haves and the have-nots, and probably largely associated with single motherhood. And I think that's where we have to think about what is really a fundamental part of the Sustainable Development Goals, which is equity and access to healthcare and equity and access to reproductive and health rights, particularly for women.
If I may jump in here, what I found most distressing reports sort of midway through the first lockdown was reports about the difference in access to care in various countries. So the fact that we're talking about a baby bust in many countries is because of the availability of choice of reproduction in high income countries. Whereas in many other countries, especially low and middle income countries, women faced a situation where clinics were closed, NGOs stopped their services. They simply did not have access to contraception, to medical care. And I think we're only just starting to see the effects of that, of higher unintended pregnancies, higher unintended birth in lower income countries. And that, I think, is a backsliding of huge progress that's been made over the last years, and a really tragic and distressing side effect of the COVID pandemic and the lockdowns that happened.
Anyone else want to weigh in, or we want to see if there are any final questions from the audience?
Could I jump in just another facet of that, which is, and I think one of the questions was leading to this. We spoke about it quite a bit, but I think we shouldn't forget the migration issue. We talked as a group about, is migration a solution for this? And so just to say, could be, but requires very appropriate and thoughtful policymaking to protect those who migrate and where they go.
And protecting those who are left behind, because what happens to those countries where the young and highly educated leave, and the older, the more vulnerable, the less educated are left behind.
Okay. So I have one more rapid fire question, since we're about to wrap up, and we will be cut off exactly at our 10:30 Eastern time. But I'd just like to know from each of you, perhaps one thing that you think will linger from COVID-19 in terms of the issues discussed today. And Felicia, you've mentioned the potential that I find very intriguing, that our flexible work arrangements might linger. So perhaps if there's that you have in mind, we can rapid fire you last, since you've already asked that really great one. But so what's likely to hang on? Mark, what do you think?
Yeah, it's a good question. I think what I would say is that I would anticipate that the effects of COVID-19 and the COVID recession will be long lasting. So it's not like we're going to bounce back in 2021, 2022, and everything will be fine for, especially for young adults. There's been research that shows that young adults who are just entering the job market, leaving school during a recession, those effects can last a long time, for decades, and even carry over, into older adulthood. So I think that the takeaway here is that these issues are not going to go away, and there's been a lot of discussion in the last hour about the impacts on women. I think the fact that women have been disproportionately affected during the recession because of job loss and other issues, that this is going to carry over for a long time.
Oh, very interesting. So perhaps no baby boom resulting from COVID.
I would not anticipate that.
Natasha, any quick remarks about what might linger?
Yeah, probably no baby boom. I would say that those people who already have children, or those people who know people who have children, basically saw the very fragile construct that many modern families have come crashing down in a very short amount of time. And so I think people who have children are going to think long and hard about having another one. And those people who observed the misery that those families went through are also going to think long and hard. And that goes doubly for, women who were torn between all the different responsibilities that often fell on their shoulders. And I think there's no easy solution to that, but it's going to linger over the next years.
So you're saying I set a very poor example of how to handle having a first and second grader at home with the emotional breakdown that I suffered. Yeah, probably so. Kwang-hee.
Yes, and we have to think about potential impact of COVID-19 on fertility on a global scale. So once, century pandemic has caused triple crisis on a global scale: public health crisis and economic downturns, also social disruptions. But there could be a fertility dip and follow some rebound, not perfect recovery in the many countries, based on historical experience, but impact likely differ due to the severity and duration on COVID-19, depending on the country context and economic performance, so economic recovery after the pandemic. Also, pre-pandemic fertility trend, as I already told you that the Korean fertility rate and Singaporean, Japanese, and Chinese has a deep drop, in fact, pre-pandemic fertility trend. All these factors will affect the recovery in fertility rate and aging of the populations. So it is very important to monitor the damaging effect of COVID-19 and try to establish a global leadership in coping with the damaging effect of COVID-19 on fertility and all other factors in the short and medium runs. That's what I would like to say relating to the COVID-19 on population matters and other economic situations. Thank you.
Thank you. And certainly I hope that Felicia's comment about some of the positives carrying over will come to pass. Well, I have come to the end of our discussion. In case you missed any of it today, the event recording will be available on the Wilson Center event page within 24 hours. And a summary of this event will be available soon on the .mom column of our blog, The New Security Beat. Thank you so much to our incredible panelists. I learned so much from listening to all of you. And thank you also to EMD Serrano for making this event possible. Thanks to everyone at the Wilson Center for your support and our great tech folks as well. So thank you everyone for tuning in. Have a wonderful rest of your day or rest of your evening. Bye-bye.
Thank you.
Thank you.
Thanks so much. Bye-bye.